First item on the agenda is approval of the agenda. The chair will entertain a motion. Thank you, Commissioner Snell and Commissioner Williams. Any questions on the agenda? Hearing none, all those in favor will please vote aye. Aye. Any opposed? Thank you. Next item on the agenda is public comment. Public comment is now open. Is there public comment? Last call for public comment. Thank you. Public comment is now closed. We move on to committee items. First item is approval of the minutes from last month's meeting. The chair will entertain a motion. Thank you, Commissioner Snell and Commissioner Williams. Any questions with respect to the minutes for last month's meeting? Hearing none, all those in favor will please vote aye. Aye. Any opposed? Thank you. We now take up appointments. Once again, we have the vacancies in the Sanitary Code Board of Appeals and on the Department on Aging Advisory Council. We have no applicants. Are there any nominations from the floor? Hearing not even crickets. We will move that on to the next month's, we will advertise again. We're now up to MSU Extension, their semi-annual report. Welcome.
Good afternoon, everyone. Thanks for having me. I thought focus on our 4 institutes that we have at MSU Extension and talk about some of the recent programming we've had and some of the highlights from the last year. Excuse me. So for our agriculture department, we've had several farm visits. We've our staff from whether it's crops or goats, sheep, horses, they visited with 40 farmers so far this year, getting out into the field and talking with folks here in Jackson County about the issues that they've raised with them. Sometimes like with horses, it's toxic plants or somebody who wants to get into farming in a particular arena or area. We have the expertise there, and we go out onto the farm and take a look at their individual situation and are able to give them guidance on what to do with their farming to be able to realize their dreams of what they want to see happen on their farms. We've had some field days. A couple to highlight for you is our horticulture educator that's based out of Washtenaw and Livingston County. She's been coming down to Jackson and working with the YPOP group and doing gardening with that group. So it's going very well. And then we also had our bee specialist who's housed on campus. She was down at the Dahlem Environmental Education Center and did a program down there on bees for that group. Moving on to our nutrition program. We've had some great success with Crouch Senior Center this year. Our Cooking for One classes have been pretty popular. We've worked with the Jackson Interfaith Shelter and David's Promise. And then our nutrition instructor has been working with the Department on Aging for the Senior Project Fresh coupon distribution as well. So that's all been going very well. And then our food safety educator housed in Washtenaw County, she's actually had 4 Serve Safe workshops here in Jackson County this year, and she has 2 additional ones planned for this fall. So that's training restaurant workers on how to safely handle food, and it's a required certificate for any restaurateur. So we've been helping in that arena. Moving on to 4-H, of course, we just finished up fair. So a few fair highlights. Our small animal auction, our revenue was about the same as it was in 2023, but we had 4 additional entries this year. So the entries went up a little bit, but our revenue stayed about the same. We had 47 new buyers that registered for the small animal auction, and 30 of those either purchased at the auction or provided add-ons for youth. And an add-on goes directly to the youth who are showing that animal, and it's a way to support individual youth in their hard work of raising animals. For our large animal auction, we raised $648,000 for the youth here in Jackson County. So all of that money goes directly back to those youth that are selling their animals at auction. So that was pretty exciting. That was a 7% increase over last year. And add-ins or add-ons alone were over 105,000. So that's, people who may not have funds to purchase an entire animal, but they still want to show their support of the youth. So they might throw $25, $50, $100 in addition to the purchase price that youth gets from the buyer. So, and there again, we saw 71 new buyers that registered for the large animal auction, and 50 of those bought animals or had add-ons. Our fall enrollment for 4-H kicks off in 4-H. That's the time frame to do that in order to be able to participate in fair next year. So we're trying to get those deadlines out and make sure everybody knows December 1st is the deadline for re-enrolling in 4-H. We don't have any banquets scheduled for this fall. We're looking at doing those maybe in the springtime. So, and then our youth and adult participation updates. We were slightly higher than 2023. We had 435 youth enrolled this year, 430 last year. So we're seeing that steady increase that we've been seeing post-pandemic. We have over 150 active volunteers. Those are adults that go through our background and screening process, and they give countless hours to our 4-H program, and we just could not do it without those individuals, and so we really appreciate them. We had 25 new active volunteers this year alone, so we're starting to see those numbers increase as well. We have 4 new outreach clubs, and we've held 10 workshops for 4-H so far this year, so that program's going very well. And then finally, in our Community Development Institute, a couple of highlights there. Our Government and Community Vitality group, we don't have anybody housed in my district. They're housed elsewhere in the state. But they've conducted 12 programs, and we've had 42 Jackson County residents that have participated in that. And so it's everything from good governance, how to learn about being on a planning commission, other commissions and boards where we have vacancies, trying to encourage people to get active and participate in their local government. And so those are programs that we've had. And then lastly, our product center, also in our Community Development Institute. Our counselors, we have 2 in the district, 1 in Monroe, 1 in Washtenaw, but they've been helping 3 small businesses here in Jackson County, and they've provided over 250 hours of staff time to those 3 businesses to help them get their businesses up and going. Look at ingredient lists, try and get the proper certifications that are needed. If they need cold packing, they align them up with the cold packers and all kinds of stuff that they do with those individual businesses to see them succeed. And then we had 7 additional programs that were offered for small businesses and had 11 Jackson County residents participate in that. So that's, maybe for somebody who's thinking of starting a business but not really sure where to start, they can enroll in those programs. And those programs are all free for the individuals. It's only once they engage with the Product Center, it's $100 to engage. And we've already given up 250 hours of staff time for those folks. So, that's all I have, and I'm open to any questions.
Questions for MSU Extension? Questions? Commissioner Willis, please.
Thank you, Mr. Chair. The training programs, what is the title of that, and how do they access those programs?
It's called the MSU Product Center, and if they want to get in touch with me, I can put them in touch with our counselors that are here in Washtenaw and Monroe counties. Yep.
Thank you, Mr. Chair.
Other questions for MSU Extension? Chair will entertain a motion to receive the report. Thank you, Commissioner Bear. All those in favor will please say aye. Aye. Any opposed? Thank you. Medical Care Facilities Financial Report. I think Madam Director's here.
Good afternoon, everyone. Okay. As we head into this report, I just want to draw attention to a couple typos under July's narrative summary. Both the financials for the month say less than budget, and the revenue says less than budget. Those should both read better than budget, so I apologize for that. So I want to start off with May. One of the things I want to note throughout this next 3-month period is revenue continues to be better than budget, but expenses have been the issue for us this year. And I'll touch a little bit about that at the end. So for May, financials for the month show actuals from operation less than budget by $305,000. Revenue was better than budget by $11,000, but expenses were over budget by $316,000. The census was under budget by 1.45 bed days. So we were expecting a census of 183. We had a census of 181.55. For June, financials for the month show actuals from operation less than budget by $21,000. Revenue was better than budget by $279,000, but expenses were over budget by $300,000. Now, our census was in line for that month. In fact, we were better than budget by 2.5 beds. So our average census was 185.5. Our budgeted census was 183. For July, the financials for the month showed actuals from operation better than budget by $191,000. Revenue was better than budget by $24,000, and expenses were under budget by $167,000. And for the month of July, we also had a census of 186.61, which was better than our budgeted census of 183 by 3.61 bed days. We are in the process of doing a budget amendment. We've presented it to the board. They have not yet voted on that budget amendment. However, they did ask us to present the financials for July as if that budget amendment had been approved. So there is where you'll see some differences with the expenses, and that is mainly attributed to the change in the proposed budget amendment that has yet to be approved. I know that's a little complicated, but just to share a little bit about the budget amendment that is pending. We did increase the average census by 1 because we are now seeing a higher higher census overall. We did increase our case mix for Medicare, which is a higher payer source, from 9% to 12% because we are seeing a lot more short-term rehab, and that's going to impact the revenue side of things. In addition to that, we are also booking $1,130,000 of Medicaid revenue that's expected from certified public expenditure. So in the past, we have never booked this as potentially received revenue until the end of the year audit. Because of the way the budget is currently flowing, we wanted to make sure that the board and the commissioners are all aware that that is money that we are expecting to receive. It does typically take more than 1 year to receive it, but it is something that would be included in this year's revenue. So we did add that to the budget amendment, and that's where you're going to see a big shift in the amount of revenue that is shown as the budgeted revenue. But in addition, we've also done some recalibration of the, this year is nursing wages. So fortunately, we are fully staffed. We no longer have agency staff. We did make the switch to 12-hour shifts at the beginning of the year. And with that, it actually required more FTEs than what we had had previously. So that was a piece of things, and we've had a couple consistent need for what we call premium shifts, where we're paying extra for people to pick up shifts last minute. We've done a lot of things in the last couple months to curb that, but we did make a change in the nursing wages. One of the things that we found was that we had budgeted for about 18 FTEs for LPNs, but we were consistently running about 24. So that was a big piece of the expense issue previously in the year. We also increased the expenses around dietary and food costs because we have seen those food costs continue to go up, and also health insurance costs. So those were also increased in that proposed budget. Ultimately, that budget does come out to have a net position of $70,000 $34 to the positive, so it is still budget neutral, which is what we told you when we reported at the beginning of the year was our goal for this year, was to present a budget neutral budget. So even with that amendment, we are staying true to that. So overall, year to date, that puts our revenue at 234,101 better than budget. Expenses are 946,996 less than budget, with a change in net operations currently of 712,895 less than budget. Now, with the changes that have been put into this proposed budget amendment, this is taking into account the losses for the first 7 or 6 months of the year. And so that will still, if we say true to this new budget amendment, will align with that $70,034 that I just mentioned. Any questions on the budget amendment that has not been finalized or the financials before I go any further?
Questions? So let me make sure I understand then. For the budgeted, we're picking up that additional $1 million revenue that you mentioned.
Yes.
Roughly, whatever it is, $1 million. Does that mean we have 2 of those items in the current year budget or just one? In other words, are we picking up 2 years' worth of that incremental revenue in the budget you're about to amend?
No, we are picking up 1 year worth of that revenue. This particular year just seems is a much larger amount due to the increase in nursing wages that we made at the beginning of this year. So this is what would be accrued over the course of this year, payable to us at the end of the year.
Okay. And then I see that expenses have been the problem, okay?
Yes.
But we had quite a swing, I guess, from June to July. Expenses were over, but under budget by 167,000 in July. That's a $467,000 swing. What's kind of contributes to that?
So most of that is by implementing the proposed budget to run the financials for July. So that's what the board asked us to do, even though they have not approved the final budget amendment, but they did ask us to do the July financials based on what that budget amendment would be. So a lot of that is taking into account those increases in revenue and those increases in expenses that we added to the proposed budget amendment.
So, and we don't have financial statements attached to our board packet. Is that because we don't have them or because they didn't get attached for July or like year-to-date July?
I believe those were sent over prior to the meeting, but I can resend them.
If you would do that. It's
Yep.
not, did I not see it?
There is an attachment. I don't know if that's not what you're looking for, but there is an attachment.
Seeing the attachment is like the budget explanation, okay? All the stuff that Destiny has gone through, but we don't see the financials. And maybe that's because you haven't yet adopted your budget amendment.
So they did approve the financials, just not the budget amendment, which I know is a little bit unusual. So I will make sure that those budgeted or those financials are over to you.
Okay, thank you.
And had them sent out to all the commissioners.
All right, thank you. Any more questions for the medical care facility? Commissioner Williams, please.
Thank you, Mr. Chair. Thank you for what you do since, well, even prior to, but since COVID. I've noticed your leadership and your work in this regard has been very well. I know you had some very challenging days ahead financially, and not to mention, the workforce and all of that, but yet you stayed consistent. And so I just want to acknowledge that and appreciate you for your work. My only question I have for you is, I think it was, help me remember, it may have been beginning of this year or maybe even last year, we had hired advertising, someone that would help with
Yes.
advertisement,
Yes.
things like that. How has that been working out for you?
So that has actually worked out wonderfully.
Great.
Because from the time that they were hired last year to now, we have no longer have any agency in our building. And at that time, we were running about 50% agency in our nursing department. So that is a huge change, and the fact that we are fully staffed in our nursing department now and remain that way. So now they have a little bit more time on their hands, so they've been helping with the admission side of things and supporting the case management team in providing tours to families, going and visiting residents in the hospital that may be potentially looking for a place to stay. So now they're helping on the other side of marketing.
But they will continue to do their PR work as needed, correct?
Oh, absolutely.
Perfect,
yes.
okay.
Yeah.
Thank you. Nothing further, Mr. Chair.
I mean, I think the other comment there is that our census is well up too, right? I
Yes.
mean, as a result, I think, of that work that was done.
Yes.
Thank you for doing that. Anything else? Chair will entertain a motion to receive the report. Thank you, and I think that was Commissioner Snell and Commissioner Bear. All in favor will please say aye. Aye. Any opposed? Thank you.
Thank you.
And now Dr. Mano with the medical examiner's report. Welcome, sir.
Good afternoon, Commissioners. Before you, you have our quarterly examiners, which is May, June, and July. I'm not going to go over all those statistics there, but I do also have August, and so our trends tend to be the same from month to month. But what I'd like you to know is that as of the end of August, the total number of cases that we've investigated in Jackson is 378. 127 autopsies were performed, and that's 34% of the number of cases that we investigate. For the month of August, we had 35 cases that we had to investigate, and to date, between all three counties, Jackson, Lenawee, and Hillsdale, we have investigated 693 cases or deaths. And for the month of August, what happens is the majority of our deaths occurred between the ages of 70 and 80, and that accounted for 60% of those deaths that occurred. And if you include deaths over the age of 60, that accounts for 83% of the deaths that we have investigated. The total ME deaths that we investigate from the home is 37% of our deaths. Healthcare facilities, which include the hospital, nursing homes, and hospice, that's 40%. And then our trauma came out to be a total of 17%. So between those three, that's 94% of the deaths that we have investigated during the month of August. And one of the things that I would like you to do is if you can look at the second to the last page of the quarterly report, you'll see a graph showing the number of deaths from January to July that we investigated. And our autopsy rate ranges anywhere from 25% to 44%, with the average being 35% of all cases that we investigate are autopsied. The average number of cases so far this year per month is 49. We're projecting that by the end of the year, we will have approximately 588 cases that we will have investigated just in Jackson. The average autopsies per month are 17, and the projected year end is going to be around 204 cases. The other thing that our office has been involved with, and the state is requiring these various committees to investigate deaths. We have, in conjunction with the health department, the Infant Death Review Committee, which reviews deaths for children 1 year and under. The Child Death Review Committee, which we review all deaths for children from the ages of 1 through the age of 21, actually. Sometimes we cut it off at 18. And then a new committee that the state is going to require is an Elderly Death Review Committee that will review deaths to the elderly And then another committee is going to be the overdose fatality review, in which in the counties, we're going to have to review all the deaths due to overdoses. One of the things that, people don't realize is, when they call the medical examiner, they think that it's an automatic going to be a autopsy involved. But what ends up happening is that the law requires not the absolute cause of death be put on the death certificate, but the most probable cause of death. And what ends up happening is it's an in-depth review because we pull all the medical records from the doctor's offices and also from the hospitals. And frequently, we check multiple hospitals because patients jump from one institution to another institution so that we come up with the most probable cause of death so that we are not spending unnecessary money performing an autopsy. When we do perform an autopsy, the causes and the reasons why we do an autopsy is one is if the death is actually unknown and we have no probable cause for it, we may perform an autopsy. But deaths on anyone under the age of 50, we perform an autopsy unless they have a well-documented medical history such as cancer, leukemia, or complications. But then the others are homicide, suicide, any suspicious death, work-related deaths, product failure that results in death, death by poisoning or drugs, any type of significant motor vehicle accident in which there are surviving drivers, death by fire, drowning, suspected accidental deaths, and deaths due to incarceration, unless there is the state of Michigan and the prison wanted us to be autopsying every person that dies in the prison. And I quoted a federal law that says that the prisoners will be treated no different than any other member of the community. So therefore, we don't autopsy every death that occurs in the county. So we autopsy those that are suspicious, actually die in the prison, out in the yard, or unattended in their cells. Many of those that do die are in Duane Waters or in the secure unit at Henry Ford. And then the other ones are medical misadventures that we have. The one thing that you have heard, we've been involved in a very high-profile case in Lenawee with the D. Warner case there. That was a person who had been missing for over 3 years, was entombed in a anhydrous ammonia tank that we had to cut open. The big problem with that is anhydrous ammonia is a hazardous material. Her body was saturated with the residual ammonia, and we had it in the morgue, which created a problem. And we have to commend facilities and the county that helped, and the county Jackson helping us, because we had giant fans put in the morgue, opened all doors and windows to take care of the fumes. The staff refused to use self-contained breathing apparatuses that I was going to request from Summit Township, but the staff did not want it. We had about 20 state police and prosecutor from Lenawee. They were impressed with our organization and our identification, and it was an opportunity for me to educate them as to what we were doing. And on the last page of the report, you will see our drug-related deaths. And the one thing that I want to point out is that everyone thinks that the deaths occur primarily in people under the age of 30, but the majority of drug deaths that occurred, and this has been a trend that's been going on, occur between the ages of 30 and 69. And if you can look at 2024 so far, which is through the end of July, we have significantly less deaths due to drugs compared to the preceding years. And our Still, our two biggest culprits in the past have been fentanyl and methamphetamine. And that's my report.
Down drastically, it looks like.
Yes, there's a lot of publication, and education going on with that.
Questions, other questions for the medical examiner? Well, we appreciate the work you do, Dr. Mano. Thank you for doing it. And thank you and your staff, I should say.
Well, the one thing that I will say before I leave is with Lenawee, Hillsdale, and Jackson, we're working on a proposal to consolidate services, standardize it, and standardize procedures. And I'm hoping that what it will do is actually help all three counties and reduce, with sharing resources, funds, and everything.
Very good. The chair will entertain a motion to receive the report. Thank you, Commissioner Bear and Commissioner Williams. All those in favor will please say aye. Aye. Any opposed? Thank you. And now the Department of Health and Human Services, Zoe Lyons, thank you for being here.
Thank you. Good afternoon, Commissioners. Just a couple of updates. With regard to our child care fund, we are at the end of our fiscal year, and we will come out close to all of our allocated budget, including the amendment that we had over the summer. I will say, I don't know who the next director is going to be. They haven't posted that position yet, so we don't even have any potentials. But the child care fund budget is something at the top of my list for my current program managers to keep an eye on. And then when the new director is hired, for them to talk about how we work in this community, the budget, and what that all looks like in terms of how a year progresses. And so, so that is on the list for the new director as well to keep an eye on. Partnership between Jackson DHHS and the YMCA. We are working to build a fund at the YMCA that will give families who have been reunified with their children out of foster care a one-year membership to the Y. We are doing this as part of our permanency for children in 12 months. The goal is typically, we give lots of services to families when their children are in foster care, and then they get reunified, and after about 30 to 60 days, when the case closes, oftentimes those resources also go away. And so we end up seeing families that come back to us when the long-term resources aren't there. So the YMCA is a resource that will allow families to go in to build their bond with each other. It will allow parents to have a moment by themselves if needed, where there's a childcare option at the YMCA. And then we're also hoping to provide camp for the kids and swimming lessons. So there's a health and a safety connection as well. So Shauna Tello and I, the CEO at the Y, were on JTV in August. I presented at the Exchange Club in early August, and the Exchange Club started us out with a donation of $2,500. And then we're also applying for a grant from the Jackson Community Foundation. So I'm really hoping that this is successful and that it helps some of our families, again, stay out of coming back into the system once they've been reunified. Infant Safe Sleep Month is in September of each year, so just sharing that information. Dr. Mano talked about fetal infant mortality review, and babies being put to sleep in an unsafe sleep condition can be one of the reasons that they die completely unnecessarily and preventable. And so we'd like to try to get that information out to everyone who will listen, so please share that on all your social media and all your connections as well. I have a list on in the attachment of our community collaborations. Really, we include this for you all so that the county commissioners can see how my staff or myself am engaged with the community. We have a whole second page of just DHHS engagements that we don't include, but that just gives you an idea of how many things that we participate in. If any of you have any questions about any of those, please don't hesitate to ask, and I can talk to you a little bit more about it. And then as I am closing out, I want to also urge you as county commissioners who appoint members to my board, including liaisons, to really consider the diversity of our community when you consider the members of our boards. We love our board members, have had really great county appointees. Kenny Price and Betsy Youngdahl and Mr. Williams have been amazing. And we have a diverse community that we work with, and I'd love to see that considered as we have our next appointees, whenever that might be, including potentially people who have actually ever had a case with my office, who might have some experience historically. So just putting that out there for future. And as I wrote at the end of my report, it's been a pleasure to serve this community as I have with the department for the last 10 years, and really looking forward to the things that we've built, being able to get even stronger with the next director. And that is my report.
Questions for Madam Director? Commissioner Williams, please.
Thank you, Mr. Chair. Again, thank you for everything. You have truly played a big role in our community, keeping families together. Well, I won't go through the resume, but you've done just a great work, and I really appreciate you. I hate to see you go, but just thank you for your work. But with that being said, I'm curious, you mentioned that the position has not been posted yet. Is there any reason why?
I don't know. I have spoken with my director many times. My goal was to have the new person chosen so that I would have some time with them before I left. It's just over 5 weeks, or just less than 5 weeks now before my retirement date, and I can just tell you, based on my experience, hiring for the state of Michigan takes a bit longer than that. I've heard that sometimes they don't let you post until 30 days before, but I've also seen other positions in the state that have been able to hire and have a couple of weeks, before someone leaves. So I have a meeting at 1 o'clock with my director. I'm going to ask again.
Okay.
I understand. I'm hoping it's going to be posted this week so that we can at least see some forward movement.
And I see that it's October 11th is your last day.
Correct.
In the event that they are able to start that process sooner than later, would you be able to be a part of the hiring practice in that?
So they wouldn't include me in the decision making, I don't think. The board, is the first step. So the board is the first interview of all of the candidates, and then the board moves to the next level, who they have chosen. I think they can move more than one person, but I'm actually not sure about that, to be honest. It's been a long time.
All right. Thank you. Thank you so much.
Sure.
Nothing further, Mr. Chair.
Thank you. Commissioner Willis, please.
Thank you, Mr. Chair. Ms. Lyons, we greatly appreciate, your service and what you've done. You've been a soldier on the forefront, helping us work with several inequities and disparities that we've had to face. And if you just look at the list of the organizations that you worked with and pulled together and collaborated with, bringing in grassroots organization and understanding there are a lot of things that a lot of time overlooked, a lot of uncomfortable conversations that had to be had. And I know you're at the forefront of making sure some of those conversations took place. So just gratefully appreciative of your work and the efforts that you put into making Jackson community a diverse and welcoming community. And we still got a ways to go, but we are working on it.
Absolutely.
We appreciate your work in it.
Thank you, sir.
Commissioner Sell, please.
So I thank you for all your work and appreciate all the work you've done. It's, as you know, unsung work. You don't get a lot of pats on the back sometimes, but we think you did a really great job here. And happy retirement. I
Thank
beat
you.
you by 6 weeks.
Thank you. Thank you. Congratulations.
Commissioner Bear, please.
Zoe, thank you for what you've been doing. Thank you for your service. I like your reports. They've always been thorough and easy to follow. So I appreciate what you've done, and happy retirement.
Thank you. Thank you, sir.
I will also wish you a happy retirement and hope you won't be a stranger.
I'm still staying in the community and gonna do everything I can to stay involved. So thank you so much.
I think we could find a few places for you.
All right, thank you.
Thank you, Madam Director.
Thanks.
And next up is our, oh, yes, let's receive the report. Thank you, Commissioner Williams and Commissioner Bear. Thank you. Any questions? All those in favor will please say aye. Aye. Any opposed? Thank you. And now the Department on Aging. Madam Director, good to see you.
Good to see you. For my report for this month, I was just kind of sticking on the healthy side of things and thinking about some different events that are going on at the Department on Aging. We have our fall prevention event that we're actually working with Wellwise Services. We're more so hosting that, but offering the space and helping to promote the event as well. And this is a great opportunity for individuals in the community that are just wondering about what I can do to help prevent falls at home, how to prevent falls when I'm out, looking at adaptive equipment to make sure am I using it properly. So often at times people get a walker and they're not looking at the height of that as they're using that for mobility. The same with the canes. So you can actually bring your devices in, make sure that they are looked at by an occupational therapist to say, is this the best device for me? And am I using it properly? It'll be a great time to highlight community resources that are out there, promoting our senior center activities, our congregate programs, home delivered meals if that happens to be a need. So we see this being attended by seniors themselves as well as caregivers bringing individuals in. And the great thing about what Wellwise is doing is they're doing this in all 3 counties. So this is actually something that's available in Lenawee, Jackson, and Hillsdale. So we're looking for just a good turnout for that event. So just sharing that information. We're very in tuned as far as trying to make sure that we're getting feedback through the survey process. And I wanted to highlight what's been happening with our exercise program. I won't go through all the responses, but just to go through and highlight some of the things that have happened with the program. As you review those survey results, you'll see that the majority of the people that come to the exercise program come on a regular basis. They're either attending the programs weekly or several times per week. For example, the Fit After 50 class meets Monday, Wednesdays, and Fridays. So they might be coming one day or they may be coming 3 days per week, depending on how that person is able to attend. Also, with the big question for us that we always like to highlight is, has the program helped you live an active and independent life and thinking about performance measurement? And that's a 98% satisfaction with that question, with 88 responses saying yes. On a scale of like 1 to 4, it talks about the program themselves, how the exercise classes are going. 71 responses were very positive with that. So just to highlight a few things. Also some comments that were also noted on the surveys. I'll just mention 2 of those. And there I kind of listed like 5 of them for you. But definitely there was more. One was, this is helping to keep me healthy and it motivates me. So that I think is a very positive response. Also, love this class. It really helped my balance. Again, going back to thinking about that fall prevention. If we're able to keep people active, engaged in coming to these classes, hopefully this will also keep up their mobility. As we know that falls are something that can lead to more significant health problems and can also lead to early placement in care facilities. Some other interesting details, 216 people have participated in these exercise programs. The eldest participant was 92 years old. The average age of all the participants was 72. And also with these classes, this is something where people can donate back towards the programs that they're attending, and we average about $500 a month just on donations for the program. So I think that that's showing that people are very engaged, happy to have these services available available to them. So this program, the exercises classes, are funded either through our senior center, but the majority is funded through our disease prevention grant with Wellwise Services. So, and donations help to capture and help us to do more in the community with the classes. So the 3 classes that are highlighted are the ones that are kind of the core group of exercise between the Fit After 50, the Enhanced Fitness, and Moving for Better Balance. But last year we also started drumming, which has continued to grow in size. So we average probably between 15 and 18 people that will come in for the drumming class, and also line dancing. So there's an intermediate class as well as an advanced class. So people can kind of pick what works best for them. So that's all I had for the exercise classes, but I also then always like to give the feedback from people in the community. And this was a recent email response that we got from a caregiver. They had reached out and wanted to express their gratitude for the home visit and everything that has helped their parents. Just to highlight a few things, they wanted to thank Laura and all the staff at the Department on Aging for your sincere concern, listening, and action. Meals on Wheels is literally a life-saving program. Within 1 month, our parents are healthier and happier. They also noted, we now realize they were not getting the nutrition needed, and Meals on Wheels is so helpful. And the connection with the caring staff are very important and very much appreciated. So there's multiple contacts that happen with the meals program. So it's that assessment that occurs where somebody gets to sit down with that social worker to, see if there's other resources that can help that elder stay in their home, connect them in that way, and do, of course, the paperwork for the grant side. There's the contact that happens when those seniors or family members call our office and need to make changes to their meal plans, let us know if they're not going to be home on a particular day. And then the big thing is those drivers, that contact with the drivers on a regular basis, just to make sure that that senior is okay. So again, just to highlight all that.
Questions, comments for the Department on Aging? Commissioner Williams, or Willis, please.
Just asking for a friend. Does this fit over 50? Is there a starting recommended condition, or is this?
I think people will just start a class and then figure out if it's the best fit for them or if they want to go a step down. So I think there's all multiple levels, but I also think that the instructors do encourage people just to do what you can. So you can, a lot of it's just being around other people too, because you get to know others and you work out together, and you can always modify any particular workout so that it's best for your needs.
Thank you much. Thank you, Mr. Chair.
I hope your friend finds that interesting.
Oh, I do want to mention too that those programs that Fit After 50 is offered at the Spring Arbor site as well, so it's not just at the Crouch Center.
Any further comments? Chair will entertain a motion to receive the report. Thank you, Commissioner Williams and Commissioner Bear. Any further comments? All in favor will please say aye. Aye. Any opposed? Thank you.
Thanks.
And now the Health Department and the budget amendment with Cecilia.
Good afternoon. So yes, I am here to present the recommended budget amendment for the Health Department for the year. There's 2 things that I just want to highlight regarding the budget amendment. There was a grant that was received for $202,000, and it was for the school wellness program that needed to be recorded. And then the other thing, we had to have pay back Medicaid after we did all of our cost reimbursement reports of $474,000. So those are the 2 highlights with the budget amendment that needed to get reported. Are there any questions?
Let's get a motion on the floor, and then we'll have discussion. Chair will entertain a motion to adopt the amendment. Thank you, Commissioner Bear and Commissioner Snell. Okay, yes, so let's can we just understand the nature of the difficulty with Medicaid
It was
there?
Medicaid. Yeah, there was 3 Medicaid cost reimbursement reports that needed to get caught up on. And the only thing I could really, having reviewed them and looked through them, is if you kind of go back, what was going on 3 years ago was COVID, right? And so a lot of the staffing within the health department got reallocated from Medicaid-type programs to the COVID response grant. So the costs were just down in those Medicaid departments from what I can, after reviewing it, that would explain why we would have to pay back $474,000, because they advance us a lot of money. And so at the end of the day, after everything was done, that's where we ended up at.
Okay, so I'll just note what I gleaned from the budget amendment is that, yeah, we had to pay back some money, and the effect on the county's budget basically is that instead of using only 300 and some odd thousand of our fund balance to balance the 20, is this 2023 or 2024?
24.
So the header is not correct for this 2024 budget, right?
Oh, both my headers have 24.
Okay. The column heading in our packet says 2023 budget, so, but it is 2024.
Yes,
So we're
sir.
clear on that. We were going to use 300 and some odd thousand of our budget. Instead, we're going to use
Yeah,
850,000
Exactly,
of
the fund balance,
Okay. And so what that means is using some of the savings account that's at the health department. Is that effectively correct?
that'd be correct, yes.
Okay. All right, we have a motion on the floor. Any further questions by members? All those in favor of the budget amendment will please say aye. Aye. Any opposed? Thank you.
Okay, thank you.
If I may.
Mr. Administrator, please.
I just wanted to point out, though, that, in case it was lost on somebody, that while we're paying that 800 and some thousand dollars, or I should say hit to the fund balance, almost 500,000 of that was Medicaid money. So it's not our general fund money. Yeah, it's just their fund balance that we didn't spend the money, so we had their money and we had to give their money back.
But it was sitting in our fund balance.
Their fund balance, health departments.
Right, well, I say our, I mean the county.
Yes,
The health
yes.
department fund
Yep,
balance.
that's what it was. We were drawing interest on it and we're not paying them back the interest.
And we still have an adequate fund balance at this stage?
Well, we frankly generally try to keep non-general fund departments' fund balances low. And because we don't want those excess dollars sitting there, we try to budget accurately and not give them more money than we need to. And in some cases, like the health department, we're giving them the minimally required amount already. So that's the idea.
Okay, thank you. Any further comments on that? Okay. Thank you, Cecilia, for making that presentation. And now the Health Department. Welcome. We understand Kristen can't be here today.
She cannot, so I get the pleasure of joining you. For those of you who don't know me, I am Holly. I'm the Deputy Health Officer over the Community Health Education and Promotion Programs. So I am here with you today. I think first we're gonna.
So Holly, one of the things you'll note about county commissioners is some of us don't hear very well. So you'll want to project right as you speak to us, okay?
I will do my best.
Thank you.
That better? Okay. Okay, so up first, there's a couple asks, so I will make it as short and sweet as possible. But the first thing we're looking at is the opioid settlement funds. So we released an RFP on June 7th. Many of you are already aware of this process. Proposals were due from the community to us by August 2nd, and we received 3 proposals. We established a panel of 5 staff members that extensively reviewed the proposals. They used a scoring tool from the Michigan Association of Counties template, and their result was to award $240,000 to Home of New Vision's Jackson Engagement Center project. So that is our first request.
And so members, you see the report from staff and the recommendation from staff that 120,000 per year,
Per year, yes, it's a
240,000 in
two-year.
total be awarded to the Home of New Vision. And this is a recommendation to the full board. Questions on that? Commissioner Bear, please.
Thank you, Chair. The opioid settlement funds that we anticipate receiving are going to be $162,000 for 2 years. We're allocating 120 of that 162 to Homes of New Visions, Jackson. The other 42,000 each year, what are you doing with that?
The 42,000, from my understanding, would just remain,
I'm sorry, I couldn't hear.
the 42,000 would just remain in standing for whatever we do after the first 2 years for the
So you just
project.
hold that 42,000 for whatever you need it for.
Yes.
Okay? Thank you.
Commissioner Williams, please.
Thank you, Mr. Chair. So picking up where Commissioner Bear left off, so this 42,000, if I'm understanding correctly, the remaining balance, it still has to be used on things that are opioid related, correct?
Yes, correct. So basically what we did is that there is funding that is coming into the county and we didn't have a plan for it. So we came in November of '23 and offered to put this RFP out for the community needs. We received 3 proposals. This is really for the first 2 years. Should something different be decided to use the funds for moving forward, we would do so. And the remaining money stays in that pot.
Right, so just so that we're all clear, just so we can kind of clean up the last comment that was made there. So that remaining $42,000, it's not to be used just for anything, but it has to be used specifically for opioid-related.
Correct, correct. All opioid funds have to be related for opioid-related purposes within our community.
Thank you. Thank you.
And
Nothing
Deb,
further, Mr. Chair.
Deb has a comment. Thank you, Commissioner.
Yes, I just wanted to further clarify. Keeping in mind the opioid funds, we don't know when we're getting them and we don't know how much we're getting. So that is an average. If you keep in mind that 162,000, it says average per year. 1 year we might get 200,000, the next year we might get 100,000. So that's why we've been so conservative in planning our services that we are utilizing these funds for, is because the key word there is average. So there may not be 42,000 sitting there. We may be using it all until we get our next payment. The payments are random. We don't know when we're getting them and we don't know how much we're getting. We basically get an email that says you're getting a check next week. That's how it works. And so it's very difficult for planning purposes. So we're trying to be conservative because we don't want to front money in planning these services. We don't want to have to front money out of the general fund for this. So we're trying to use the money when we receive it. So there's no fronting money or prepaying for programs that we don't have the money for in the general fund. So that's why we're being so conservative in this. But it doesn't necessarily mean that there's money sitting there. And this is part 2 of the money, keeping in mind. Part 1 of the money, remember there's 2 settlements, and the first settlement is being used to fund a health educator in the health department. This is the second part of the funds, which the commissioners, as Holly indicated, voted to utilize in an RFP process. So, so this is the second part of the money, not the first part.
Commissioner Bear, please.
Thank you. Since these are averages and not guaranteed, if it comes that next year we get 110,000, I would expect you to come back and modify your award from 120 down to the 110 we actually receive.
So what we're trying to do is we're trying to make programs sustainable. So with that being said, you don't want to give a program 20,000 one year and 50,000 the next. So because that means their program is constantly fluctuating and the services that they're offering are constantly fluctuating. So we're trying to plan accordingly, which is why we did a 2-year grant, if you will, or a 2-year RFP, so that these people that are bidding on the RFP can have a sustainable program. So we don't know how much we're getting next year, but we will do our best. Like this year, we're we're asking for approval for the Board of Commissioners to give it to the Home and New Vision. Chances are Home and New Vision is going to want to continue their program as long as it's successful and meets the needs of our RFP. And so most likely they will rebid so that they can continue their services. That doesn't mean they're guaranteed all the money because we don't know how much money we're going to get. Keeping that in mind. So we're trying to be as responsible with the funds as possible. So if that makes sense.
Okay. Thank you for the explanations, and the chair will entertain a motion to recommend the staff recommendation to the full board. Thank you, Commissioner Bear and Commissioner Williams. Now, Commissioner Willis, did you have a question?
I did. I was trying to. I'm sorry. Thank you, Mr. Chair. I was trying to understand the criteria sheet. So I see there's like 5 different scores, but are those for different portions of the proposal?
No, if you look at the scoring template that you have access for and how each of them, there's 5 different ones, that's per staff member who did the review.
Okay,
And
so
then
it's
it's
5 different
broken
staff
down,
members
yes,
there.
5 different team members made up of different people throughout the health department to bring different perspectives. So, and then each proposal is listed as, I think, an indicator on each of those 5 charts.
Okay. All right. Thank you.
Yes.
Any further questions on the matter? Now to the motion. All those in favor will please say aye. Aye. Any opposed? Thank you. That passes.
Okay.
Okay.
So next we have, we're looking at an amendment to our kindergarten oral health assessment contract. So as you know, we've been in partnership. We've contracted Smile on Wheels to do our oral health assessments here in the community. We were really early in getting on board with this program, and now moving forward, every county will have to do that. But we've had such a successful partnership with our Smile on Wheels team. They have completed 813 assessments just in at the end of Q3, so at the end of June this year. And 125 of those were untreated decay with 13 of urgent needs, which is roughly a 23% decay rate in our county. We also know that access to service is a very difficult thing. So what we're requesting in this is that kindergarten, or that Smile on Wheels has the opportunity to do Medicaid outreach on behalf of the Jackson County Health Department, which really means that they're working to connect the people that they're screening to services within our community, Medicaid-related services.
This is all grant money and
Go ahead, Commissioner Bear.
It is a reimbursement from the state for Medicaid services. So we have a format that we utilize when we do Medicaid outreach, and there's a tool that we use, and then we submit that to the state, and they provide us reimbursement for that.
thank you.
Yep.
Okay. Further questions? Chair will entertain a motion to move this on to the full board. Thank you, Commissioner Bear and Commissioner Snell. Further questions? All those in favor will please say aye. Aye. Any opposed? Thank you. And now on to flooring.
Okay, so we have been working, many of you already know, on some cosmetic and visual updates within the health department, the human service building. Painting has been completed in our clinical services and WIC area, so now we have been looking at flooring. We've gotten some bids. So the request here is to approve a purchase of installation and removal of flooring for $62,654.
Commissioner Williams, please.
Thank you, Mr. Chair. So this is coming from your budget?
Yes, this is grant funding,
Oh,
so
grant
from our public health infrastructure workforce grant, and it is all grant funding.
Oh, okay, I didn't see that. Okay, thank you. Nothing further, Mr. Chair.
Just a question for administration. This is approval here as opposed to going to the full board? Because it's under 75,000, okay? For members, this is approval at this meeting, okay? Anything further? Chair will entertain a motion to approve the flooring. Commissioner Snell and Commissioner Williams, thank you. All those in favor will please say aye. Aye. Any opposed? Thank you. And now the monthly report, Holly. Thank you.
Yeah, so monthly report, it's really been pretty much business as usual. A couple things to highlight. Really gearing up for back to school. Many of our programs are school-based, or we have a lot of interaction with this school. For prior and leading up to, there were many back to school blasts, back to school events that a lot of us attended. One that was super successful was for our school wellness program out in Concord. We had the opportunity to speak with a lot of families in regards to what the program is and getting the word out, as those students have to be consented to see our mental health provider and our school nurse out at that program. And so far it's going really, really well. Additionally, immunizations is really important leading up to that kindergarten year. So our immunizations team did an amazing job at extending their hours to make sure that all the community had their needs met prior to returning to school. We did have 2 birds test positive for the West Nile virus, but thankfully we have not had any human cases in our county at this time. And that's all I have for you.
Questions for the Health Department with respect to the monthly report? Bless you. I will note that the Back to School Blast, which my wife chaired, I'm so very proud of her. They gave away 1,250 backpacks. So there was a lot of,
amazing.
and thank you for having your organization there and over 50 other community organizations that were there. I think we saw something recently about an outbreak of pertussis. Can you comment upon that, please?
I believe that we have 1 active case in the county. It is highly contagious. Our communicable disease team is working very closely with them at this time. But from my understanding, it's only been 1 case so far.
Highly communicable and easily vaccinated for, which I put on my Facebook page and immediately found those who think that vaccination is somehow bad.
Yeah.
That's incredible to me. But just for public consumption, vaccination is good. Okay. Smallpox is no longer around. Polio is almost no longer around because of vaccination. Kids get vaccinated. They need to be vaccinated, especially for things as easily vaccinated for. Diphtheria, pertussis, tetanus, all the childhood vaccinations, okay? Further questions for the Health Department? Otherwise, the chair will entertain a motion to receive the report. Thank you, Commissioner Snell and Commissioner Bear. All those in favor will please say aye. Aye. Any opposed? Thank you.
Thank you.
Thank you, Holly, for being here. All right. We move on to the claims. Chair will entertain a motion to pay the claims.
Motion to pay the claims.
Thank you, Commissioner Williams and Commissioner Willis. All those in favor of paying the claims will please say aye. Aye. Any opposed? Thank you. Please take note of other minutes that are in your board packet from the DHHS, medical care, and the VA. We're now up to public comment. Public comment is now open. Is there public comment? Any public comment? Last chance for public comment. Public comment is now closed. Committee member comments. Any committee member comments? Commissioner Williams, please.
Thank you, Mr. Chair. So we, after receiving today's report, I was reminded of the Home of New Vision has their recovery walk, I believe this Saturday at 11 o'clock. And I can't remember the route off the top of my head, but I'm sure if you reach out to them, they'll be able to give you that information. I believe the start time is 11 a.m. at the Home of New Vision. Thank you, Mr. Chair. Nothing further.
Home of New Vision being at the corner of First and Michigan, is that right? Yep. Okay.
They're walking Concord or Cortland to Mechanic to Earl this year instead of down Michigan Avenue.
Sounds like a downtown walk. Commissioner Willis, please.
Also, this Saturday is the Hispanic Heritage Festival down in Blackman Park for those that are interested. That's an awesome event. Lots of good food where you'll need to go to the Fit for 50 after, but good time, so.
Make sure your friend knows about the Fit for 50. Any other commissioner comments? Hearing none, we stand adjourned at the call of the chair.